So there's a type of phototherapy which is kind of like management, do you understand? So you actually use this in low resource settings. Okay, so this is a filtered sunlight phototherapy. So they usually abbreviate it as what? FSPT. Filtered sunlight phototherapy. That's what I was saying is management. It's good for you to know it in case you find yourself in a low resource setting place. Okay, so filtered sunlight, just have to do it. You put something to filter out the sunlight while you put the baby to undergo the phototherapy. Do you understand? So the filtering is basically to take out the ultraviolet lights that will be dangerous. Okay, so it's just an innovative, it's low cost treatment for neonatal jaundice. Do you understand? You mostly improvise. All right, so this is, you use safety materials that will actually reduce the wavelength of the light, basically taking out the ultraviolet light. Okay, so you harness the natural sunlight which contains a blue light spectrum. It's effective in breaking down bilirubin. So however, because sunlight also contains harmful ultraviolet light and infrared, it must be filtered. So you basically use the filters. It can be special filters, all right, or you can also still improvise for those ones and use some white clothing or so. So locally available is the window-tinting films too. You can use them. Then polyester filters too. So you use this in neonatal jaundice, and that's basically in places that have limited access to, you know, the sophisticated type of phototherapy. Alright, so contraindications: if there's severe hyperbilirubinemia, you have to actually go to a place where you are getting the 100% treatment. Preterm infants or those with unstable clinical conditions. Alright, basically use that for conditions where it's not really, you know. Alright, but if you have access to a good hospital, please, you have to actually go there. So remember the eye protection so that the baby is not exposed to too much bright light.